I'm Dr. J.R. Kelly coming to you from PetMart Pharmacy. Today what we're going to talk about is a general physical exam on your pet. So today I've got one of my dogs, Beasley, here to demonstrate how we go through a full physical exam, say if your dog was just to come in for a yearly, or of course this could be your cat. But what I typically do is I'll start at the head, the tip of the nose, and work all the way back to the rear end. So what we're generally looking at is, well, for Beasley, you can see that he's getting up there in age and he's starting to show his gray color. But we'll start by looking at his teeth. So looking for any signs of tartar or gingivitis, which he's got a little bit of tartar building up on those back teeth, but for the most part, the gum line looks very healthy. Beasley did get a dental cleaning yearly, just as a disclaimer. This is not how clean his teeth normally are. Then looking at his eyes, looking at general pupil symmetry, making sure that they're the same size, that they're typically responsive to light if I were to shine a bright light in them, making sure that the corneas are clear and free of defects, and generally that he's visual. Now, obviously we can't get him to look at a sign and read letters off of it for us to test his vision, but we are able to test general ability to see objects and trace things in space. So from there, we'll typically go to his ears, looking down into his ears, making sure they're not full of debris or red and irritated, any signs of infection or inflammation there. So then also feeling the ear canals and making sure that some dogs have very chronic, long-standing infections that will get very thickened, hardened ear canals. His are nice and pliant and soft, so his are good to go today. From there, we'll typically feel all of his lymph nodes, so the lymph nodes up underneath his jaw, in front of his shoulders, up underneath his armpits, back in his inguinal region or in his groin, and then the lymph nodes that are back here on the backs of his knees. We'll listen to his heart and lungs to make sure everything sounds clear, that he's got a regular heart rhythm, he's not too fast or too slow. Obviously today his heart rate is going to be significantly higher than it is at home if he's just relaxing. Sounds good and clear. Also listening to his lung fields in all four quadrants to make sure that there's no signs of bronchitis or pneumonia or anything that would be affecting him respiratory-wise. From there, we like to get a good feel of his abdomen and make sure that everything's nice and soft and all of his organs are in place in their normal size and shape. Again, looking for any signs of any kind of liver dysfunction, kidney dysfunction, bladder issues. Everything feels nice and soft there. From there, we just take a good look overall, making sure that his skin and coat are healthy, that all of his joints feel good and are pliant, and he's not getting too arthritic with age. And then outside of that, just anything itchy skin, red irritated skin, any signs of fleas. Those are the general things that we're looking for on a physical exam. From there, everything for Beasley checks out today, so thankfully for him, no further poking or prodding. So that'll do it today for our general physical exam. Again, I'm J.R. Kelly coming to you from PetMart Pharmacy. And if y'all have any questions, please feel free to call us at the PetMart Pharmacy number.